Today I want to talk about an interesting case that I did last week. This is a case of an implant that slipped. This patient came to me about 6 months previously. She had a chin implant. Came to me because she didn't like the shape and kind of how the projection, how it was looking. And what I found on exam is that I think the implant actually, instead of sitting on her chin like this, had completely fallen down. This lump right here is the implant sitting under her chin. So it was sitting kind of like a smiley face under the chin instead of sitting on the chin and sticking out. So here is what we did to solve this problem. So the first step was removing the implant. It was a Gore-Tex implant. So what that is, this is a rubber but coated in Gore-Tex. So these are a little bit harder to remove, but not as bad as the old Gore-Tex strip kind of custom implants people used to make. Then what I do every time that I am replacing a chin implant or doing a genioplasty to replace a chin implant, I measure how thick the implant is and how much the projection is, or in this case, the planned projection. And then I have a series of different implants that I bring with me. I find the one that matches, that has the same projection. In this case, I think the implant that she had was way too big. It extended way too far on the sides, but the patient did like that it gave her some additional volume in the epigastrial sulcus. So this is a special kind of chin implant that gives projection anteriorly, but it also fills in this area, what we call the epigastrial sulcus. Sometimes when patients have a small chin, they also really need some volume on the side. So this one fills this in and then augments that a little bit at the same time, but without being so long and so wide, because in the case of this patient, the implant was going like almost to the back of her jaw. Then what I do is I take measurements of the chin bone. In this case, her chin was slightly asymmetric. So what I'll often do is just burr a little bit on one side to help with the symmetry of the chin and help the implant to sit. The final result is, instead of an implant sitting there, it's now sitting properly on her chin, giving her some nice projection, filling in the sides. She's only a few weeks out, so it's still really swollen, but I have full confidence that as the swelling goes down, we're going to see more definition and a nice projected chin shape.